Good morning. It is April 3rd. We always start with a pledge and prayer, so if you're in attendance, please stand. Commissioner Davis, would you start with the pledge?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Commissioner Coleman, will you open in prayer?
Dear Heavenly Father, we come before you with thankful for all the blessings you bestowed on each and every one of us in this county. Lord, we thank you for allowing us to get through the storms last night without losing our power and the threat of tornadoes. We just are so thankful. Lord, we ask for wisdom today and guidance to making the decisions that are needed for this county and that would please you as well. We ask all of this in my heavenly precious name. Amen.
Thank you both. Let's jump right into approving the minutes of March 27th. Commissioner Davis, you would have to abstain from that. So
Yes.
Commissioner Coleman, if you could provide a motion.
Yes, I will make the motion to approve the minutes from March 22nd.
And I will vacate the chair to second.
Ms. Coleman,
Aye.
Mr. Powell,
Aye.
Mr. Davis.
Abstain.
In the matter of request for appropriation of funds,
Any comments or questions on our appropriations? Hearing none.
I'll make the motion to approve.
I will second.
Ms. Coleman,
Aye.
Mr. Powell,
Aye.
shoot,
Oh,
Mr. Davis, sorry, Mr. Powell.
I'll aye again.
In the matter of request for appropriation transfer of funds,
Comments or questions on item 3? Hearing none.
Motion to approve.
I'll second.
Mr. Davis,
Aye.
Ms. Coleman,
Aye.
Mr. Powell.
Aye.
In the matter of approving payment of the regular schedule of accounts for various funds, moral obligations, and then and now certificates in the total amount of $251,060.27.
Nice to see a low number on the docket. If there's any comments or questions? Hearing none.
I'll make the motion to approve.
I'll second.
Ms. Coleman,
Aye.
Mr. Davis,
Aye.
Mr. Powell.
Aye.
In the matter of accepting miscellaneous reports,
Any comments or questions on our miscellaneous reports? Hearing none.
Motion to accept.
I'll second.
Mr. Davis,
Aye.
Ms. Coleman,
Aye.
Mr. Powell.
Aye.
In the matter of contract agreement between Nile Township Board of Trustees and the Scioto County Sheriff Department regarding expanded police protection.
So this is extended police protection between the sheriff and Nile Township trustees for one deputy. It's 5 days a week, 8-hour shifts with a total being 40 hours a week. That is a monthly total of $10,245.60, a yearly total of $122,947.28. Any comments or questions on this contract? Hearing none.
Motion to approve.
Second.
Ms. Coleman,
Aye.
Mr. Davis,
Aye.
Mr. Powell.
Aye.
In the matter of Portsmouth Metropolitan Housing Authority Annual Statement of Consistency of Public Housing Authority Plan with the Community Housing Improvement Strategy, CHIZ.
So this is our 5-year plan with the public authority housing. Any comments or questions? This is a requirement that we do every 5 years. Hearing none.
Motion approved.
I'll second.
Mr. Davis,
Aye.
Ms. Coleman,
Aye.
Mr. Powell.
Aye.
In the matter of revised change order number 1 for the Scioto County Fort Hill Marks Communication Tower.
This is original contract price of $1,044,834.49. Change order increase of $25,750.80, making a new contract price with a change order of $1,070,585.29. Any comments or questions?
How much was the change order for?
25,000.
It went through last week,
It went through last week. As
and it was
39.
an increase of
39.
something like that. And from what Amanda, her email said, the sheriff was not supposed to be included in that.
He had already paid.
Okay, so they had to remove that, so we put it back through as revised for the decrease in the amount.
That explains the difference. Okay. All right. Thank you.
Any additional comments or questions? Hearing none.
Motion to approve.
Second.
Ms. Coleman,
Aye.
Mr. Davis,
Aye.
Mr. Powell.
Aye.
In the matter of reappointment to the Portsmouth Public Library Board of Trustees,
We have a letter of request for reappointment to the Board of Trustees for the Scioto County Public Library. Ms. Ruth Ann Brush has served diligently on this board and is requesting to continue her time with them. We appreciate, of course, anytime somebody serves on a public board as a volunteer, but we appreciate Ms. Brush and her willingness to continue to serve. Library trustees serve 7-year terms, so this term would end on June 30th of 2032. Any comments or questions? Hearing none.
I'll make a motion to approve.
I'll second.
Mr. Davis,
Aye.
Ms. Coleman,
Aye.
Mr. Powell.
Aye.
In the matter of resolution proclaiming April 2025 as Child Abuse Awareness and Prevention Month in Scioto County, Ohio.
So today at 2:30, there is a child abuse awareness event with Job and Family Services. This will be presented then, should we pass. But it is a resolution proclaiming April 2025 as Child Abuse Awareness and Prevention Month in Scioto County. That agency does a great job protecting our kids. Children's Services runs through there. The enhancements they've made, I believe the director from JFS, statewide JFS, will be down as well to celebrate with them. But they're having this event at 2:30. Any comments or questions? We can read the resolution then.
Any questions?
Nothing? All right.
No.
If I get a motion.
I'll make a motion to adopt.
I'll gladly second.
Ms. Coleman,
Aye.
Mr. Davis,
Aye.
Mr. Powell.
Hi. That is the end of our agenda for the day. Is there any questions, items on agenda? On agenda? Nothing? Nothing? Any questions, items off agenda or comments? We have some folks in the crowd today. Mr. Dunn, if you want to go ahead.
Yeah, we'd just like to thank you guys for helping the disabled vets and disabled kids this year with the trout derby. Hopefully we can get ODNR online next year because it's hard to come up with the money. I mean, this has been a fight, but thank you guys for helping us, get it going because this would be the biggest one we've done. So we just want to say thanks.
Todd, we appreciate the hard work you guys are doing on this. I know you've expanded the event this year to include the students at Burn Rock School coming on Friday. And the outreach that you guys provide, the opportunity you provide for our disabled vets and our children is outstanding. And this isn't the only event. You have your no-kill deer hunts, your pheasant hunts. So what you do for our veterans and our kids is phenomenal. We appreciate you, and I know you guys get a lot of support from the local VSW and the Post and the Eagles and all the folks in those organizations that continue to pour into your mission. So their efforts are absolutely appreciated as well. Any additional comments?
Just going to add my thanks as well. As he said, what you do is, it just can't be replaced. So we think.
Well, we shouldn't have to fight for the vets and kids. Not in this area, because there's nothing, like that to do it. So,
Sure.
hopefully we can get a hold of him and change his mind by next year.
We'll work on it. Thank you.
Thank you, Tom. I appreciate everything you do for our veterans, and they are most deserving. They really are, and the kids, the young people, and the residents. They're just a joy to be around, and it's just a wonderful event. And if anybody wants to come out, I'll say this: if anybody is having a down day, come and see the joy on the faces of these people. You'll feel better. You'll feel better before long. And thank you for all your hard work. People don't realize how much it takes to coordinate what you are doing. And you spend hours and hours and hours putting this on. So thank you.
This is 8 weeks coming here, just try to help get it, just that part of it. So
Yeah.
But the vets deserve it. I mean, without the vets, we're nothing in this country without the vets.
Yeah, that's right.
So
It wouldn't be here. Thank you.
thank you guys.
Any additional comments, questions?
Yes.
Please go up to the podium. Let us know who you are and why you're here. This is more, we know why you're here, but this is more for the people watching on Facebook.
All right. My name is Joe Brook, and I've been a part of the community all my life, grew up here. And I've got a concern over the drug addicts that are coming to our community. I have a question is how did this come about that Scioto County seems to be a deposit, if you would, for drug addicts all over, and I'm not putting them down, I know they need help. But how is it that Portsmouth and Scioto County became a place where they all come? Because it's not helping, at least from my point of view, it's not helping the community. Housing, a lady the other day I was talking to, she's a widow, tried to find a house to rent, can't find a house to rent. Everything's being gobbled up by people using it for drug housing. And I don't see how this is helping our community. And I know you guys are working hard to try to improve the community, but this to me is counterproductive. So my first question was, how and who started this?
So I have an opinion on it. I think we all probably have an opinion on it. I think the fact that Scioto County was ground zero for the opioid epidemic, where we saw most people, it started here. So pill mills, everything. But by default, that put us ahead of the curve for the treatment side of the equation too. Scioto County was really the first kind of breaking out into treatment and focusing on this issue because we were impacted by the opioid issue before many parts of the state. So by default, our infrastructure for treatment grew and grew and grew, and it kind of stayed here. Over time, some of those industries were marketing, quite frankly, to other counties, marketing to judges in other counties, hey, send your people here, we have an infrastructure in place. So you didn't see the treatment infrastructure grow around the state in any meaningful way. So I think that's the first part of the question. How did it happen? I think that's why. We were ahead of the curve on the opioid pill mills, and by default, we're the first community that said we needed to do something. How do we fix it? And that's when we got ahead of the curve on the treatment side of the equation as well. Now there is efforts at the State House level. I know Representative Pazzulli has put forward some legislation. It's currently in committee. It's House Bill 58. House Bill 58 will increase the standards to even be able to open treatment housing. What it will also do is create a certificate of need where it will limit how many treatment options are in a given county, given zip code based on population. So there's a formula that Ohio Mental Health will figure that out. They'll figure that out on their side. I know myself, I went up and testified in support of this bill. Sheriff Thurman, Prosecutor Tiemann, we had the opportunity to go testify on this bill literally 2 or 3 weeks ago. The first step of what has happened was last year in the budget bill. It went through where these entities had to even register that they exist. Prior, they weren't even registered, so we didn't know who was in the community. That went into effect. They all had to be registered by December 31st. We now know that there's over 110 recovery houses in Scioto County. That is the same equivalency of the recovery options in Franklin County, where they have 1.2 million people and we have 72,000. So there is an effort, Joe, to build out infrastructure across the state. If this bill passes, and I think it does have the support from folks on the recovery side that's doing a good job, because their reputation is being dragged down by the poor performers as well. So there's kind of support on both sides of the equation to create a certificate of need across the state, where you can't just keep piling on a single community to be the recovery hub or the recovery region of the state of Ohio. So if it's successful, I think we'll see some of this take care of itself. Standards will increase in terms of licensure. There'll be a standard to be able to go in and make sure that there's an actual complaint process, an actual survey process to make sure these people are up to code, up to standard, up to a quality of life that these people deserve while they're in treatment. So there's efforts happening. A lot of it has to happen at the state level. You can't zone it out of existence. We've looked at that. You can't. There's ADA protections because this is a site of healthcare. So really, it's a change that has to happen at the statewide level, and I encourage anyone that's supportive of specifically House Bill 58, because it's going through, to reach out to Rep. Pizzulli and reach out to Senator Johnson, should it make it out of the House, to support this bill and this effort.
Well, you said 110 houses. How many counseling centers do we have?
I don't know. I'd have to check with the Adams board to see what that number is. If you're talking about separate entities that are also doing the recovery houses, I don't know that number off the top of my head.
Okay, I just know that there's just
There's
quite
a lot.
What is the success rate for these?
Yeah, that's a great question. So, and this was something that I even brought up in my testimony. So, the other side of my life, I'm in healthcare, and recovery is healthcare. Well, in every sector of healthcare that I work in, there is a quality standard. You get reimbursement based on certain quality standards within that healthcare. That does not yet exist on the recovery side of the healthcare equation. So probably what will happen after we get just the basic standard, what I foresee happening in that space is that we'll start digging in there, and that the taxpayers of the state of Ohio will want to know, am I getting a good return on my money? A lot of this is Medicaid dollars. Are we spending our Medicaid dollars wisely on providers that are truly making an impact and having success? But right now, you're right, there's not a meaningful measurement, be it recidivism rate, success rate, staffing required. Like there's a lot of pieces and parts that need to be looked at. We're just so far from that. Just like I said, last year they weren't even registering who they were. We now have that. This next step is making sure that they're up to a certain standard of quality. I think once that happens, then you'll start seeing the other pieces kind of get piled on as well.
Okay, I just know from, just watching things over the years, I just see, it seems like just a constant decline.
Yep.
They get their housing paid for, they get transported, their housing, I mentioned the housing paid for, the counseling's paid for. I understand they get access to the Life Center. There's privileges they have that I've got friends that can't afford. I'm thinking, this isn't right. How are they contributing back? And what came to my mind is I was coming to town a couple weeks ago and I see all this trash. I said, isn't there something that these people, what's the consequence for their bad choices? I know some of them, because maybe a doctor prescribed and they got hooked and the doctor cut them off. I understand that. But there's a lot that's made bad choices. And to me, it's like there's almost being rewarded for bad choices. I may be seeing it wrong, but I just, I'm discouraged in what I'm seeing. I understand there's some 15,000. Is that an overestimate of in our county of drug addicts coming?
I don't know that I've ever heard that number. I don't know that that's been quantified, so I'm not sure where that number's.
I know out by where I live, there's at least 2 real close, and I'm just concerned for family. We got these people coming in from out of county. We don't know these people. A lot of them are just staying here for various reasons. I understand. I don't know. Something's got to change. I just wanted to express that to you guys, and I understand that I've talked to Jim Pelusi myself about this bill we were talking about, but when I look and see what's happening to our county, I got kids, grandkids, they have to go somewhere else. And, unless something turns in this county, it's just, and I hate to see that. So, anyway, I just wanted to express that. And my thought was, I see them out playing basketball in the parks and all. Why can't they be out picking up along the highway? Why can't they clean the streets, the county roads? They're getting a free ride, and we're paying for it. I don't see them having any skin in the game, so to speak. And I just think that's an injustice to the community. So, and to me, unless there is some real positive benefit, lasting benefit, it's a poor investment. And I know that sounds harsh, and I do care, and I have reached out. But it's like, you do your thing, we'll do our thing, and I don't know, I see this as a burden to our community, and unless it's rectified, I don't see how things are gonna turn around, so. You know, just yesterday, I was sitting in my office looking out the window, and all this trash just blowing down the street, and I'm thinking, what's happening? You know, so anyway, I just wanted to express my concern. Things gotta change. It's not fair to a taxpayer to see they get all these perks. And I got friends that can't afford some of the perks that they're getting. And so it's on their dime. You see what I'm saying?
Sure.
So anyway, I just wanted to express that, and thank you for hearing. And I appreciate the military and the service they do too. I just wanted to express it to you. Thanks, buddy.
Joe, if I could express some thoughts on that. I'm old enough to remember where I remember when I first came into office, we only had 2 providers in this county. We had 2 providers in this county, and that was 10, almost 11 years ago, okay? The proliferation of treatment centers and housing, the housing piece of it has really become more and more a thing in the last 4 to 5 years, where treatment centers was the hallmark back then, but they found that in order to get people clean, you also had to give them a bridge out to society. And that's when the treatments, or the housing started, the housing piece. And what I have seen is a major proliferation and increase in spending in this state and at the federal level on this issue, that multiple times over, they have done this, because this started as an Appalachian problem, and now it's a nationwide problem. You mentioned, that it seems like we're or that we have more than anybody else. Lawrence County now exceeds us, believe it or not. It's where the money flows free. There hasn't been regulations in place that really govern what you have to be able to prove, as far as licensures and things like that, that you're actually going to provide quality health care to people. That hasn't been in place, as Commissioner Powell mentioned. That just started in the last couple of legislatures, in the GAs, in General Assemblies. And it's been an ongoing process. I sat, and I don't know if I had a chance. We've been kind of busy here lately on a personal front, but I sat in our county commissioners meeting 2 weeks ago, I guess it has been now, and we were discussing HB 58. I talked to Representative Pizzulli about it. And very glad that they're presenting that. It's another spoke in the wheel to get this thing fixed. But as I said in that meeting, there was no commitment to back it in the room, because part of the problem is you have counties that are benefiting from sending their people here. They're literally exporting their problems into our area. And, they're seeing their overdose rates drop, and we're seeing ours go up. Actually, I think it's actually gone down a little bit here lately. But the problem is, this is big money. There is big money being made on this. And we have gone from where Big Pharma was the one that was making all the money, to where Big Pharma is still making big money because they're creating the drugs to treat it. And now people are addicted to those drugs. So the situation is, number one, it's unsustainable. When the state of Ohio spends more, and Commissioner Powell drew this out, when they spend more on someone in recovery than they do grandma or grandpa in the nursing home, that is fundamentally immoral, unethical, and just flat out wrong. And you could even take that over to our veterans. We're spending more on people in recovery than we are on our veterans. And we could debate that one all day long, but I believe our elderly and our veterans are a group, a class that need to be protected and provided for. So, and a lot of times they're the same ones. They're the same people. So, but, in 58, House Bill 58, what it does is it will force reallocation of revenues. It will force reallocation of resources to where the 23 counties in the state of Ohio have 0 treatment centers. But yet they're sending them all here because we have infrastructure, or to some other county. They're getting flooded. Let's just face it, and you do hand-to-hand combat with the devil every day, and so do all of us. The devil created the perfect weapon of mass destruction when he created fentanyl. Let's just face it. Look what it's done to our society. And that continues to proliferate. And the recovery process is so much worse with fentanyl. Now, carfentanyl's making a big comeback. We're seeing all of this. And then what it's doing to our families. The mental health crisis of our families when they lose a loved one. And you've got families that have lost more than one person. They've lost multiple people. Not just families, but friends. And the carnage that all causes. We have a mental health crisis in this community because you have people's lives that have been devastated and ruined forever. And it's so sad to see what's happening. And then, not only what it's doing to neighborhoods, like you mentioned, not having housing, not having where even a middle class, someone coming out of college maybe, they can't even find a home right now because they're all being bought up. You're right. We have a housing crisis, and that is all across the state. It is not just Scioto County. I'm telling you, because I talk to commissioners everywhere, and it is everywhere. They do not have housing. It's all been gobbled up for different reasons, but housing, I'm telling you, recovery housing has been a big part of that. So it is a problem. We are absorbing huge costs at the local level. Our judiciary, law enforcement, what we're absorbing at our township level, EMS, fire, responding to all of these incidents, overdoses, our EMS is wore out. They are wore plumb out. They are desensitized, a lot of them now, because it's going, you save somebody and they're back out using 2 hours later. And 6 hours later, they pick them up again. That happens, and it's part of it, and we're not seeing improvement. We're not. I know that there's good treatment centers out there that are doing good work, and I do not want to belittle anyone, but there are some people that are preying on people, literally just victimizing them. But we do need a certain element. We do, and what those numbers are, the necessity. Those numbers have already been borne out. We did a study 2 years ago on this, and they wouldn't release the study. That's crazy. I mean, what are we afraid of? We need to know those numbers. And that's the other thing, Medicaid, they don't release numbers. They won't share data because they don't want us to know the failure rate. We talk about success rate. Let's talk about the failure rate, okay? And I will tell you, where there's a carrot and a stick, like in our drug courts, the success rate is much higher. And what you mentioned, as far as getting out, community service, things like that, it's not that it doesn't happen. We do. I can tell you, some providers put crews out. They work with our solid waste district. They go out, they work. I know probation. There are some, not all, not even close. And so there are groups, companies that are giving back to the community. But I understand what you're saying, and we need to bring that back, because community service is something that has been lost in this whole thing. It's the heartbeat of our community that's being lost here.
Can we stop? You know, I've talked to people, a lot of people are talking, whether, I know they're not probably coming here talking about it, but you talk to people, and they want to know, why are we accepting other people's problems?
Yeah,
You know, stop
yeah.
it.
Wish
Why
we
can't
could.
you stop it?
Wish we could. We have nothing, and I've always said this, the commissioners, any county, board of county commissioners in the state, we are creatures of statute. The Ohio Revised Code dictates everything we do. There is nothing in the Ohio Revised Code that gives us the power as commissioners. And you can drop it down to the trustee level. You can drop it down to city officials. Now, they have a little bit more power than we do because they're self-rule. But in the Ohio Revised Code, we don't have a law that's been passed by the General Assembly that says the county commissioners can control, regulate, mitigate, you name it, this issue. And I know there's a lot of confusion out there. There's people that say, and I see it on Facebook all the time, and it drives me crazy. Well, the county commissioners, this, and we invest in recovery, and we're spending county funds, and we're doing all that. That is patently false. That is not true. Along with that, we don't have anything in the Ohio Revised Code that says that we should fund recovery. Okay? So it's this issue has proliferated to the point to where it is unsustainable. And we have said this multiple times. Commissioner Powell was in Columbus not too long ago. I have testified in Columbus. We have brought this issue up. Representative Pizzulli, before him, Representative Baldridge. We have brought this issue up. Senator Johnson has brought this multiple times. Before that, he was representative. He was doing that then. This issue has been our issue for so many years. And I will be honest with you, and I feel this with all my heart, and I'll make the claim and I'll stand by it. We have not gotten the attention at the state level because here we are, we're down in Portsmouth. Out of sight, out of mind, okay? And we gotta scream. We've been screaming, and we're starting to get attention from the leadership in the caucus, the leadership in the GA, but it's taken time. And now we gotta get everybody on board to not only stop the proliferation, but fix the system. Fix it. It's not working. It's not working. We are losing this battle because we are not thinking outside of the box. Prevention is the greatest model, and we're paying for that ourselves here at the local level. We've asked for prevention dollars at the state level, federal level. We've been at this so long at the local level, everybody knows, a lot of people know, a lot of the companies know what it takes to fix this issue. You gotta do prevention, and you gotta do mental health. See, and a lot of times those lines cross. They do. I mean, they really do. But you gotta fix this. You gotta fix this. And a lot of people are missing that. I'm sorry, I've opined it pretty long, and you're going to kill me because you gotta type this all up. But if you don't fix this, you won't fix the addiction. And you know that as a pastor. And it takes a lot to fix this because we have a lot of broken people in our community. And that's the answer. We got to fix the heart. And the answer is Jesus, right? I'll say it out loud in the ACLU. Too bad. I'll say it, okay? But the answer is Jesus. And a lot of faith-based organizations is the answer, okay? But then the government puts limitations on that. And they got to get out of the way and let them do it.
Comments, they don't want to fix it because there's so much money flowing in. Well, I don't know where the money's going, but I'm not seeing the benefit of it. And you see a house
Right.
bought up, use the bedrooms for housing. Next thing you know, lights in the attic, now there's bedrooms up there. Then the garage behind the house gets made into housing. It's like, where does this stop?
And there's fire codes that should be followed, occupancy codes that should be followed. And something that was very important that Commissioner Powell mentioned, that a lot of people don't realize, is that you can try to zone, you can do all of that. The City of Portsmouth tried it. But that ADA, American Disabilities Act, addiction is now classified as a disability in the United States. So that changed everything at that point. So it made it harder. It really did. And because of that, municipalities, everybody have to be very careful how they do legislation, because you can get yourself in trouble. And that's part of the battle they fight in Columbus right now. Sorry, just wanted to get that out. Thank you for bringing it up though.
I won't belabor it. You know how passionate we are and how, you know, how we feel about it, but, Commissioner Davis mentioned when he came in, there were 2 facilities. When I came in, what would that have been, 6 years later? There were 18. And now, you know, in 8 years, we've got over 100. And, you know, we've talked about the effect it has, but, you know, we're also talking about the homeless situation. The population is growing, and I truly believe that they'll come here and then they're released from their program and they stay here. They don't go back to where they came from. And then you add the children. All of these patients that are being treated, most of them have children, families. We've heard, how many times we've heard grandparents are raising the grandkids because someone's passed away from an overdose, or they're in jail, or, you know, they just don't want to take care of them. And that, we saw the effect of that a few years back when we had over 400 children in foster care. And that has come down to about half that. And then, you know, I want to think about, a few years back, we did the research. We couldn't get a definite answer, but the number of out-of-resident patients in this community way outnumbered the residents that were seeking treatment. And then to go right to the problem, and they both mentioned it. I sat here when I first came in, and we were downstairs at the time, and we met with a legitimate organization. You asked me about this, the success rates. They wouldn't discuss it. They talked about completion rates. They were all about that. They could not answer. They couldn't give us an answer on the success rate. So there you go. I don't even think they have the answers to that. And then shortly after that, sat right here in this room, and with our legislators at the time. And when I asked them point blank, you know, about what they were doing or what could be done, I was told we have to go after the low-hanging fruit. We have to approach the governor about the low-hanging fruit. And I said, this is not one of the low-hanging fruit, you know. And they said they just told me that they would have to. They couldn't approach that subject. Then to get what they wanted done, they had to discuss what the governor was on his agenda. So, you know, it's been 6-8 years now. State Representative Pizzulli is doing wonderful. You know, he's making the effort, and I would just encourage everyone. You say you talk to all these people out there. I do too. Put that word out there. Send those letters to the governor. Just bypass the legislation. Send it to the governor, because he is the one who, when it comes down to it, can do something about it. So, flooding with letters, you know, do what you have to do, but that's where the answer lies. And until, even with this meeting that you attended, you know, I may not even see it a turnaround. Hopefully I will in my lifetime. I'm 71 years old, but they're just not paying attention. So if they're just not paying attention, how long is it going to take for things to be put into place, for regulations, rules? So it comes back on us. We can all sit here and talk about how bad it is and how it's affecting everything, but we all still have to do something. Not just us, not just your legislators, but the people that live here. And if you want change, you've got to make the change. So I highly recommend that you get your emails out or your pen and paper and start there. Sorry.
No, thank you both. Thank you for the question. Any other comments in room?
Alderman Mike Kane, I'm glad he brought it up.
Okay.
I'm real familiar with this, okay? I know people that's been going to these facilities for 8 years, and they're still doing drugs. These facilities, cure rate, I was told is 4%. And like you said, it's all about the money. And these people that are doing facilities and the group homes, it's money. If you're a drug addict, I ain't gonna cure you, I'm gonna lose money. It's all about the money. As far as our state representative goes, in the past 15 months, I've called both of them 3 times. You know how many responses I've had from them? None. Requested face-to-face, requested phone calls, zilch. That's what our state representatives. Now, if they're trying to do something on this issue at the state level, they should have had meetings with the public and got our public's opinion. I don't recall either one of them meeting with us wanting to know our concerns. I don't know what's in this bill, but there might have been some stuff they could have put in that bill that we would like to see in the bill. And the people that's coming in here, and I know these guys are facing a financial issue over it. The counties that's sending them here should be sending them money that we give them for their insurance, their food stamps, their housing. It all should be coming from that county that ships them in here, not our state representatives. And senators need to be addressing that with legislation. Because if that county up the road has to spend $1 million to Southern County, you'll see that stop. Because then they'll say, hey, we'll just spend it here when I send it down there. And I think there should be a requirement. And I don't know that they can do it. I think there should be a residency requirement of 12 months before you can even sign up for a program in Southern County. But it would have to be the whole state for all counties because it's too easy to come here and get what they're getting. One company has 49 locations in Southern County. I'm not going to say who it is. One company has 49 locations. And I know people's been going, not just to those, but all these clinics. 6, 7, 8, 9 years. And they're not getting any better. And they're not. They do drug screenings when they go in.
I know, I visited a clinic. I was dumbfounded when I walked up to this clinic. It stunk. I was thinking I went in the wrong door because I thought there's nothing professional here. It looked like a dump. But they're getting the money. I thought I was in the wrong place.
Well, I'm going to make a challenge. I challenge my state representative and I challenge my state senator to call me. Same how I've called them. And whoever that I speak to on the phone, he takes my concerns. I haven't seen nothing addressed. And I challenge them. I don't know if they voted on the Senate bill you're talking about. I've never seen a public meeting asking for our input on what we want to see as a community. I challenge them. I challenge them to call me. I challenge them to have community meetings so people such as this gentleman and this gentleman with his, they can address it straight to them. Because when you get up there, as some intern, I'll pass it along.
Make sure you leave your name and number.
Oh, I've left my name.
No, with us. We'll make sure
I've left my name, my cell phone, my home phone, and everything with them. And here we are today.
Well, I'm saying leave it with us and we'll make sure we get it to them.
Okay, I appreciate that.
Yep.
That wasn't why I came. But he got me started. And he's got a legitimate concern. Because these places can come right next door to you and do what they want. And if you hear of someone that's going to open a facility or a group home like that in your neighborhood, I highly recommend you get your neighbors together and you get out there and you confront the people that are going to purchase these facilities and put them in and tell them, we're not going to give you any rest if you put that in our facility because evidently we don't have nothing to fight with except ourselves. I mean, it's that bad, I think. But anyway, your item 7 on your agenda, that was something.
Let everyone know who your name is.
Oh, Ross Hamilton from West Portsmouth, Ohio. On number 7 there on your agenda,
Yep.
do you guys, for lack of a better question, and you know what we've been fighting over there where we live there with the Coles Park Garbage Salvage, the EPA come in, done an inspection, and there was a cleanup done on it.
Okay.
And the cleanup, it's been brought up to standard. They're now car crushing, and I was told by one gentleman that's interested in it, when the car crushing starts, it's going to be sold. And the same gentleman told me that PMHA's going to put lead terrace 2 right there. Do you guys know of anything like that?
I haven't heard of any plans for that location.
Because we don't need that over there. We got enough problems with lead terrace, with gunfire going on over there and everything, and the drugs. We don't want that for a back door. And as far as this property, I've been told there's one gentleman that is very interested in it. I don't know exactly what his intents are, but he does have a drug rehab facility. And he has another business. And I don't know what we can do, other than just be mad. And when I was talking with the EPA, when they came down, I met with them twice. One of them, they sent a supervisor with the other representative. And I don't want to throw you guys under the bus. I don't want to throw nobody under the bus. I said, who regulates junkyards in the state of Ohio? Do you guys have any input? They don't have any input. They don't regulate. Their remarks was, well, it actually goes back to your sheriff's department and your county commissioners. I said, what? You're telling me the state of Ohio has no department that oversees junkyards and their standards? So, I'd like for you guys to look into that and see what you can find out, because I just don't believe that.
Yeah, my knowledge of that is it's actually health departments.
Well, they didn't
We'll look
mention,
into it.
they didn't, but I'd like for you to look into it, because it's like, what? I just don't, I can't, it's hard for me to imagine. We got all these departments and everything, but nobody oversees junkyards and their standards and where they can be built and the whole 9 yards, just like the rehabs. You know, it's just like, and of course you guys, you know where I'm at on this junkyard stuff, because it's right up against me. And same way the drug rehab, FITGO in it, it's right up against me.
Yeah.
I don't want to have to sit there and fight people off, keep them out of my garage, my house, or whatever. If it be a rehab, that's what you end up with. And there are good rehabs out here. I'm not going to say they're all bad, but you can probably count them on one hand. And we got war going on in our county, and it's been brought down on us, and I'm going to place the blame. I'm going to place the blame on my state representatives and my state senator, because I've never had meetings with the community to get our input. I've never heard nothing back from them on what they're doing to fight it. We're not being informed. I've never seen once where they had a public meeting about the rehab facilities and things, not once. And hopefully they got stuff in that bill that give you guys some authority and they can stop it, but I don't think they will. Just personally, that's my opinion. Don't have much faith in them right now. And I don't know. But I would like for you guys to look on this junkyard rehab facility, because our neighbors, we've talked about it. What do we do now? I don't know. Go to the Ohio Department of Natural Resources, see if they can declare that land behind us a wetlands, but it's on private property, so I don't know if you can do that. And, you know, I don't see any of the rehab people, and I don't see any of the junkyard people. I don't see them building those things next to their house. They don't want them in their neighborhood. They don't want them next door to them. But they'll put them next to me or you without no respect to my property, the value of my property being devalued, the safety of my property, be it a junkyard with the rats and the rodents and the tracks, or be it a drug rehab facility. And we don't know who's in them facilities. Sex offenders, pedophiles. Anybody ever been notified? We don't know. Because you know what they'll do? HIPAA. They're big on HIPAA. They're real big on HIPAA. And something's got to be done. Thank you guys for listening. Appreciate your time.
Appreciate your time. Yeah, we'll look into it. Probably take a couple questions online. It'll be the clerk's choice since we can't see what the questions are. It's on your shoulders, Amanda.
Thanks. There's a lot.
Okay.
One question from Vicki Holly. Why does Scioto County have 110 sober houses when counties with much larger populations have less? I'm all for people getting help, but many people that are here aren't from our area. 110 houses for recovery, but how many homeless shelters do we have for our homeless?
Yeah, so there's one homeless shelter. I think we covered why there's so many, just through the nature of that business and our inability to regulate that. Once again,
I would like to
House Bill 58 is an option there.
I would like to make one statement.
Real quick, because
I don't want people
trying to be mindful of everybody else.
on these rehabs. I hope every single person off of in these rehabs, every single one of them, regardless of where they're from, I hope every single one of them tomorrow is clean.
Yeah.
And healthy and go get a job. That's what I want.
Yeah.
But it's not happening because it's just a business. It's becoming an industry.
Yep.
But I want to see people cured. But I know it's not happening. I know it's not happening. I see it every day.
Brian Cottle asks, who issues the business license for these companies to operate within the county?
Business license would be issued through the Secretary of State's office. Once again, in terms of the registration and the certification, that's going to go through the mental health at the state level. If the legislation passes, it'll provide the local Adams Board the ability to investigate, certify, survey their licensure. Right now that does not exist, so it's just some filing through the Department of Medicaid, Department of Mental Health, and then of course Secretary of State's website.
Stephanie Thurman asks, are there any spring/summer cleanup days scheduled for this year?
I have to double check. So I know all the different townships have theirs. So depending on what township you're in, check with your trustees. We'll have to check with Solid Waste District to see what he has scheduled. But I know our townships take advantage of the funding available to them. Normally that comes from them, so we're not.
Check Facebook, because
Yeah.
I've seen them pop up.
That schedule's not always shared with this office.
To answer your question, on one of that, at one time, I was told, like I say, you can't believe everything here. At one time, I was told these rehabs, I was told it fell under the pharmacy board.
I
see some of them.
Yeah, it probably depends on exactly what they do. There's several levels, but it probably depends on exactly what they do there, whether it's level 2, 3, 1, sober living or otherwise. But
Right.
there's probably some oversight there.
Stephanie Thurman also just made a comment, said that she hasn't seen litter pickup around here in a while on the roadside.
We just got a report, and we can share this on our Facebook page. Part of our miscellaneous reports was from probation about how many hours they have spent cleaning up. 216 hours. That's for March 1 of 31. 216 hours. It talks about how how much money they've saved the jail, how much fines was recovered, 455 gallons of trash bags on 327. So it is happening, whether or not you've seen it on your road or not. We have a lot of mileage in the county, but the work release and the Department of Probation, they do a very good job getting out there and tackling some of these roads. And then I also know Solid Waste District pulls folks from the Star Justice Center to tackle roads as well. We've talked about this, I think, every year. There's a lot of people working on it, but until you change the culture of people just throwing stuff out of their window, they can clean up of miles, and then literally the next day you'll see a similar issue. So some education even within our schools is vital to the issue as well.
We would recommend them contacting, if she has a specific road that she would like to see covered, contact the Solid Waste District, or if it be in the city, contact the city manager's office. There are some, it's really sad. There's some roads that, and as Commissioner Powell mentioned, we have 415 miles of county roads, just county roads. We have over 600 and some miles of roads in this county, okay? Total, between state, county, township, city. So you do the math. I mean, if you do that many miles, and you've only got so many people that can clean up a mile, at a time, and they go out. The problem is, we've got some hot spots that you have to clean up 3 to 4 times a year, because the people that drive that route, they just throw their garbage out the window, and I'm sorry, that's so disrespectful to your community, to your neighbors, to others. And I know, you talk to people, they don't care. They care less. Well, people need to care, because it's costing the taxpayers a lot of money to administer those programs. We have to remember, it's not just probationers, it's not just people in STAR, but our Solid Waste District is supported by taxpayers' money on parcel fee, and they go out there and they do that work. And then, not to mention the work that they do on the recycling program, but they're going out, and I think last year's number was like 70 tons of litter was removed from our county roads. 70?
I have more tons than that.
Just on your hill, on Peach Orchard, right? But that's a great example of people proliferating that and just constantly throwing trash and not caring.
It ain't just out your window, it's truckloads of it.
Well, and then you have people that don't have their own litter pickup. They don't pay for trash service, and they're going over on Peach Orchard or you name it. I mean, there's all kinds of places, Carey's Run and Pond Run. I mean, they're just dumping, and people need to stop that, because
No, they need to put them in jail.
well, that's another issue.
Give
Yeah.
them a fine that they can't walk away from.
I noticed on our agenda, we have judges. We're 6 minutes
Yeah.
over. I don't want to be held in contempt for holding up our judges. I don't know what their agendas look like today. I did want to provide, sorry I'm cutting everybody off. I did want to provide a quick opportunity if you have any comments.
Easter Cave starts tomorrow. Those that have never been to the Easter Cave, please go out, enjoy it. If you've been to Christmas Cave, you got to do Easter Cave. It starts tomorrow, Friday and Saturday, leading up to Easter weekend. And then I wanted to thank the community. I wanted to thank my co-commissioners and the staff for caring so much about our family and the loss of my brother. I appreciate you all, your kind words, and the support that we receive as a family. It is so great to know that there's so many people that rally behind you whenever something unexpected happens like this. But we do from the bottom of our hearts and our family, we appreciate the support from the community and the love and the prayers that follow. Thank you.
I just want to say one thing. Last night, in the middle of the night, I was talking to our MD director, Larry Mullins, about the storms that were approaching and tornado threats and all of that. He is in Columbus attending a conference right now, and I had mentioned to him if we had some serious weather conditions coming to give me a text, and by George he did. In the middle of the night he sent me one. But also he was concerned. We've got 3 or 4 days of hard rains coming, And, you know, we've had the flooding issues before, not very long ago. So just be cautious and watch out for, you know, for your neighbors and those that will and might need help throughout this weather situation we're facing. So.
Very good.
Thanks. I have three quick things. First, yesterday, I believe, or the day before, one of our very own Job and Family Services, Tammy Tapman, was recognized as a children's champion. So we appreciate all the hard work. It's always great to see. It's always great to see our local team getting recognized for the hard work they do. So congratulations, Sammy. I'm sure we'll praise you here in a little bit. Also, a great job to Representative Pizzulli and Senator Johnson. Interstate funding made it into the transportation bill for a study to run an interstate, basically from Toledo down through our community on into West Virginia. What this does and has the potential to do for economic development is quite frankly huge. Behind the scenes, engineer Darren LeBron worked very hard on that, pulling engineers up and down the potential line, so he really worked hard, so appreciate their hard work. And then finally, if you haven't been out to Old Thomas Conley Park, a lot of improvements there. We really haven't touched on these, I don't think at all. New playground is being installed. It may be complete now. I was out there on Saturday. It looks great. They had some finishing touches to do. Our team out there has rebuilt one shelter house with another going up, and the hard work that they're providing in that space to get it ready for this season. And then I know the ball fields now have dugouts. So just great job to Brian and the team out there. It's looking really good. I encourage everybody to get out to the park.
I just want to add too, where the old playground used to be, where you're converting that into a dog park. So it's already got a fence where you can have small dogs and large dogs, and so we're very excited about that. And we've had a lot of interest in a dog park down there. So.
And I would clarify, this is all due to grant funding. So
Yes.
I always want to make sure, how are we paying for this?
Yes.
This is from CDBG grant funding, but appreciate the team and their hard work out there. The park's looking great. Once again, we are over on our time to meet with judges, so I'm going to entertain a motion to adjourn.
Motion to adjourn.
Second.
Ms. Coleman,
Aye.
Mr. Davis,
Aye.
Mr. Powell.
Hi, everybody have a great weekend.